My name is Dr. Hemang Shah. I made this talk for my colleague OBGYN doctors here at Kannada Clinic. But I thought I will put this up on internet as well for other physicians to benefit from. If you are a non-physician, not everything may apply to you, but let's get started. I think same thing applies for menopause brain because it's hiding in plain sight that not only many patients but even physicians are missing neurological symptoms of menopause. So I believe that menopause brain is a neuroendocrine disorder, and let's see some evidence for it. To give some introduction about myself, I'm a board certified neurologist and I'm a fellowship board certified clinical neurophysiologist. I run this Alzheimer's prevention program here at Kannada Clinic in Burlington, North Carolina. I am a Duke physician, but this program is not sponsored by or endorsed by Duke University. This is my own program. The goal today is to talk about Alzheimer's prevention and ask other OBGYN doctors who are in my practice to help me uh, create more interdisciplinary care for these patients who are going through neurological symptoms of menopause and share some evidence-based prevention strategies. I'm not alone. A lot of my thoughts comes from fantastic Dr. Lisa Mosconi and her research work and advocacy by Maria Shriver, as well as many other places. There is a women's Alzheimer's movement at Cleveland Clinic, etc. Let's go back to what I'm really good at, and that is dementia. I think the problem is that we how we define dementia. We usually start defining dementia when mental decline has already significantly happened and it's already interfering with the quality of life. I think we are behind the eight ball. As my OBGYN colleagues, we need to do more like them. For example, if we see a patient who is a stage 4 breast cancer, their mortality rate is almost 16%, or I should say, survival rate is only 16%. Versus if we can catch this really early at carcinoma in C2 stage, uh, we have almost 100% survival rate. So my goal is to try to catch these patients with the Alzheimer's pathology early enough so we can actually make a real dent and delay the development or altogether avoid the development of uh, dementia or Alzheimer's. Now, as you many of you may know, that two-thirds of patients with Alzheimer's disease are females. So why is that? Historically, we have said that it's just because women live longer, so they are more likely to develop Alzheimer's disease. But I'm not sure. There is a lot of research coming out that there are many other risk factors in women that may be playing a role. Some of the risk factors that we think it may be menopause, and I'll talk more about it. We don't have established in causation just yet, but I think we are very close. There are other features that I won't be able to talk much today. That is about chronic stress, educational opportunities. Back in the days, I think now it's almost equal, but it's still significantly disadvantaged in terms of vocational issues, increased risk of depression, anxiety, all those other risk factors. But let's focus on menopause for today's talk. Many of you are aware that menopause has significant neurological symptoms such as hot flashes and night sweats and mood changes and sleep impairments, memory loss, brain fog, and all those things. So, where do they come from? They come from inability of the brain to perform the task that it was able to perform very easily before. So there is an area in the brain called hypothalamus that's not able to regulate temperature really well, leading to hot flashes and night sweats, like a vasomotor symptoms. Their emotional part of the brain, called amygdala, can get affected, causing people to have more anxiousness and stuff like that. Estrogen is a very protective hormone for brain, and effects of lack of estrogen or irregular estrogen to brainstem can lead to sleep impairments and stuff like that. This is a fantastic slide that from Dr. Lisa Mosconi, that she showed for the first time that postmenopausal woman has significantly decreased glucose uptake into their neurons. So estrogen may act like a key to let glucose into the brain, and if the neurons are deprived of the right energy source, they may be having more issues. So these are some other places where a person can be having issues during menopause, causing neurological symptoms. I'm not the only one talking about this. There are very smart people at big institution are talking about implementing lifestyle medicine to improve menopausal symptoms rather than just giving people pills. There are also very good research organizations at big universities. They are focusing on women's brain, and I'm really happy that that's happening in my lifetime. I'm not going to talk about hormone replacement therapy or any other medications. I still want OBGYN to be in charge of that. I strongly support estrogen supplementation for women who are in need for it, an appropriate candidate for it. I do believe that risk was overestimated, and it was estimated from the patient that does not actually apply in Women's Health Initiative study and stuff like that. But that's a big discussion. So please make sure you have that discussion with your OBGYN. But overall, from a brain's perspective, I do believe that in right patients, starting estrogen supplementation early can be very protective for brain. I have studied a lot of other places that they are doing this Alzheimer's prevention, and I'm trying to start that here at Coronado Clinic. Well, I shouldn't say start that because we have been doing it for last 1 year or so, where we meet with patients who are participating in our program once a month for 2 hours to talk about individual pillar of lifestyle medicine. I'll just say a few words about each pillar. So, in nutrition, many times people may already know uh, that what should they eat, but our goal is to try to help them implement it in their life. Many times, many patients have misconceptions, specifically about nutrition. I believe people get caught up into what to eat. We forget there are so many other things that are important. For example, who made the food? Like, is it an ultra processed food or not? Or when you are eating the food. So if you eat the food at the wrong time, like really late in the evening, even if you are eating healthy food, it may not be as nutritious for you. It also depends upon what state of your gut is in. So if you're in a parasympathetic predominant state of rest and digest, the food that you're eating, you may get more benefit out of it rather than in a hurry that you're in a very high sympathetic tone. You may be eating the right kind of food, but are you absorbing all the nutrients out of that food? So I spent almost 2 hours talking about just nutrition. And during this program, I'm trying to teach people how to implement the knowledge they already have. We also have a whole session on exercise or physical activity. Uh, One size does not fit all. So we try to start people from very low level or wherever they are to best possible. So we not only talk about this NEAT, which is non-exercise activity thermogenesis, so just moving your body more, to doing some kind of endurance training, to do some kind of weight training, do high intensity interval training, or using sports to get stronger and better. We talk about balance therapy, or we talk about pelvic floor therapy. We talk about using hot and cold to train your vasomotor system. So exercise is a lot more than just lifting weights or going out for a walk. So you can do bare minimum. It's very easy to find out what's the bare minimum thing you can do for Alzheimer's prevention. My goal is to teach people what's the optimal thing they can do in their situation using the SMART goals. And you can watch my other videos about SMART goals. We talk about restorative sleep. Sleep is a time when you remove all the toxins from your brain and try to consolidate your short term memories into long term memories. I actually encourage people not to skip your sleep, even for exercise. So, like I have some patients, they want to wake up early in the morning, skip sleep to exercise, probably not a good idea. We also talk about neuroplasticity. Neuroplasticity is our brain's ability to make new connections, develop cognitive reserve, and things like that. And it is more than just doing crossword puzzle and Sudoku, right? We also talk about mental health, importance of stress management. I'm not just gonna sit and tell you that okay, just meditate and all your problems will be solved, right? We do know that we live in this complex life with family drama, work stress, relationship issues, and stuff like that. So in our program, we use this Everfit app, and I have curated lots of different videos to guide people about certain situations, how they can handle it and improve their mental health. Obviously, we do teach people the importance of meditation and mindfulness and stuff like that, and we provide resources. Social connections are very poorly understood, but large risk factors, specifically late life Alzheimer's or dementia. Now, I believe that all the principles that I talked about should be applicable for menopause women as well. We are not saying that the cognitive issue that you are having during menopause is dementia, but we do think that it slightly increases your risk, and there are things you can do. Apply American College of Lifestyle Medicine pillars of lifestyle to improve your health, and we do think that it will slow the progression of the disease down. As a take home message, I want to encourage everybody that it is a preventable disease. Lancet Commission mentioned that 45% of dementias are preventable, but it has to start early and vigorously. I do believe that genes are not our destiny. There is something called epigenetics. So, what we do makes a big change and makes a big impact. It's like genes load the gun, but lifestyle pulls the trigger. Alzheimer's is a disease of middle age that presents itself in late age years. So it's never too late or never too early to start working on wellness. And the last point I wanted to mention that even for highly motivated individuals, participating in the program improves an outcome. So uh, the goal of this session was for me to talk to other gynecologists and ask them if we can share patients and I can help them with wellness. And I have some of the other things. So please check out my website and YouTube channel.